The appointments module in Inca Clinic allows you to set up any of your clinic locations, set up consultation rooms within that, and book appointments in for patients once you've rostered staff on. Sometimes, however, it would be handy to be able to see a number of clinics side by side, and that's already supported in the current version. So I just simply add another room and I can see the locations side by side and navigate through the days. However, sometimes it would be really useful if I could always have this set of clinics loading every time I open an Inca Clinic. And at the moment I can save that view and load it up. However, I have to click all these buttons every time I click on the Appointments tab. So what I'm going to do here is I'm going to save this as a default view for myself. So I'm going to call this Dublin Clinics. Which is a feature that already exists, but we've enhanced it a little bit. So let's call that Dublin Clinics and save that. Great, it's saved. I can now go to this Loader Manage Rooms and I can choose the Dublin Clinics. And one of the new features you have here is the ability to reorder those after I have set them up. So I can have any number of rooms within a clinic displayed, and I can even remove them from that list as well. Down here, I can set this as my default view. As I'm the systems administrator, I can either choose this as my own personal view, or I can impose that on all users of Inca Clinic on this account. So I'm just going to do that right now. I'm going to click OK, and it just tells me that that's been saved. And now what happens is if I click on the Appointments tab, it will always load that view for me automatically, which is great. And that also applies to all users on the system. So if I click across to this different user, and I just refresh that tab, you'll see that it automatically loads the view that has been now set by the systems administrator. However, this particular user actually works in Cork, so they don't want to see the Dublin Clinics loaded up each time. They would much prefer to see the clinic that they actually work on. So that user can go ahead, click on the room or the views that they like to have, and they can go and set this up as their own personal view, Cork Clinic. Save that, so it's been saved. And when they go into the load and manage, they can see the other views that are available, but they can also see this Cork one, and they can save that as their own personal view. Click OK and close that, and you can see that gets loaded up. And if they refresh the appointments page now, it'll automatically load into the view that they prefer to have. So once again, just to show you, I'm back in as a different user, this time the systems administrator, and that's it. User constantly gets this look of rooms that they prefer to see. In the last release, we launched the ability for you to allow patients to select a time and book an appointment with your clinic. We've made a few enhancements again to the summer 2015 release. For example, we've now enabled a mode that allows a patient to simply just request an appointment in a particular location. So they can put in a time and date and it sends you an email if you don't want to publish out your times. Further to that, if you do want to publish out times, you can also do that and select a clinic. And again, as you're seen from the previous videos, you can select a day and a time and allow the patient to book. However, what if the patient is traveling with a number of people? Well, what we've done is we've added an enhancement that allows you to also include a number of attendees. And what this does is you can set a threshold. So for example, 1 or 2, you just keep the time slots the same. It's a half-hour appointment in this particular clinic. But if they book 3 or 4 or whatever maximum you set, it will readjust the appointment time based on a parameter you set. So for example, if it was 3 patients, you can add another 10 minutes. If it's 4, add 20 minutes and so on until it reaches the maximum number of attendees. And then it allows you to continue on with the rest of the appointment schedule. Okay, so let's skip back into the appointments again into Inca Clinic. So scenario is that you don't want to publish your appointment times, or a patient rings in and makes an appointment by phone or as a follow-up to a visit to the actual clinic. How do you allow them to be able to book ahead of time, book online like those other users? So again, what we've done is we've enhanced the Inca Clinic. We've added some new features into it. And what this will allow you to do is go ahead into a room. So let's just pick a date in the future. And I'm going to go ahead and book a 10 o'clock appointment for this particular patient. You'll notice up here that you have these care pathways. This describes the type of visit the patient is coming for, and I can make a selection appropriate to the type of visit that they're actually making. In this case, I'm going to do something a little bit different to a normal travel clinic. This patient is actually rung up for a corporate health assessment, and I've set this up as a care pathway, and we'll look at this in a few moments. You'll see there's a new section here that tells me that it's going to send me out a particular type of email template, and the health assessment is going to be a corporate health assessment. So it's going to be a little bit different to the travel assessment that you saw on the online booking. So I'm going to go ahead and I'm going to just put in some details about this patient, just some bare minimum details. Importantly, I'll capture this patient's email address. So I'm just going to pop that in at gmail.com. And then I'm going to click Save. So I've now booked this appointment in for this particular patient, and you can see that it's highlighted here. What this has actually done now is it has sent that patient an email. And when I click on that email, you'll see that it contains a link. And this can be used by the patient to register themselves before they actually attend your clinic. So I'm just going to click on that link, and it opens up, it confirms that the patient, who they are, and you'll see that's a little bit different. There's no travel assessment step, there's no travel itinerary here, because we've configured it not to include that step for this particular type of appointment. And again, I'm going to go ahead, and this patient now is in their own time, before they attend the clinic, is going to put in some details. Again, it's a very familiar form, so just let's make something up. Now, here's the difference again. So we are able to determine or dictate the type of questionnaire that this patient gets sent based on the type of appointment that they've made. So it's not a generic questionnaire anymore. So I'm just going to put in that this is a health, this is a corporate assessment. So I'm going to put in Acme Corp. I'm going to be an engineer, just make something up. And the rest of the form is pretty well as you've seen before. So we've got some new information in here, but it all works pretty well the same way as you've seen the questionnaires before. Assessment, click OK, confirm. Great. So that appointment now has been confirmed by the patient. So you might ask the question, well, what happens if the patient tries to answer that question again? Well, let's see what actually happens. So I'm going to re-click that link, and it comes up and says, sorry, you've already submitted those details. They've been put into the system. And you can see here's that corporate assessment that came in. And now you can see that information by the patient has all been filled out, and I've got an indicator to tell me that the pre-visit assessment has been completed, so I can build reports around that, etc. And now I can go ahead and convert this patient. To manage consultation templates has been a feature in Inca Clinic since the beginning. Consultation templates allow you to save and reuse a patient's trip itinerary with another patient. So for example, a family all traveling to the same destination. So it saves you having to put in that information. The way you managed consultation templates was by selecting a consultation template from a drop-down list. With the launch of the online booking and now the further enhancements in terms of allowing patients to register online, using that drop-down list became quite cumbersome. So we've enhanced this feature. So now when a patient books an online form and they create a consultation template as a result, when you add them to the waiting room, the last consultation template they created is automatically loaded for you, and that's indicated in the waiting room by this new icon, which is highlighted blue. This patient down below doesn't have an associated template, so it's great, but I could go ahead and I could select one for them. So again, we've enhanced the ability to manage templates. So for example, I could have this patient use James's template, and it will load it up and tell me exactly where that patient is going, what they're doing, and I could decide to use that template for this patient. In the same way, for James, I could go ahead and I could change the template that he's using. Maybe there's a rugby trip template or something else that we want to use as well. So that's simplified the whole ability to manage templates. Then I just go ahead, start my consultation. That information concerning where they're going and how long they're going for is already preloaded for me. And as an extension, then the online assessment form that they filled out is already completed, and I can review that for the patient. So we've made some enhancements to the invoicing screen. First up, if you want to, when you create your invoice, you can allocate it against a member of the medical team. So this could be a doctor, nurse, or a pharmacist, or anybody you define in a clinical role. The idea is that if for insurance reasons or other reporting reasons, you can then very clearly indicate that this consultation or this income was allocated against a particular doctor, and that information appears on the invoice when you send it to the patient. Some other changes that we've made on the payment method. You'll notice here that the add edit buttons are missing, but if I click on it, they appear. This just simplifies the whole process of adding and removing payment methods from an invoice. You'll also notice that we've also added the ability to add a surcharge onto payments made by, say, credit cards, so you can offset the cost of credit card processing. This is completely optional, but it will recalculate the fee on the invoice based on that. So that's just a highlight of the new features that are coming up in summer 2015 of Inca Clinic. If you want to go to our website, incaclinic.com, you can have a look at that in more details, and you can also sign up for a 15-day free trial. So thanks for listening.